Analysis. Well, the psychodynamic approach has led to the development of what we call psychoanalysis. So the approach is psychodynamicism, and psychoanalysis is the kind of therapy that has come out of psychodynamicism. Sometimes you'll see the approach called the psychoanalytic approach as well. These two terms are often used kind of interchangeably. But in psychoanalysis, somebody spends a lot of time talking to a therapist about the content of their dreams. They tell them about what's happened in their dreams. And the therapist can then use these psychodynamic techniques to try and analyze the dream. What does that dream actually mean? What do you really want? They can look past the manifest content and look at what the latent content is and kind of engage with the person, talk about it, try and see if there's anything they can do to try and resolve these conflicts without dreaming about them, and kind of try to develop more healthy mechanisms to cope with it. But psychoanalysis has been criticized because it gives an enormous amount of power to the therapist. Like, they basically tell the patient what's wrong with them. And if the patient disagrees with them, well, there's nothing they can do because the power is all in the hands of the therapist. You know, if you say, I had a dream about eating a cheeseburger, and the therapist says, that's because you want to murder your father. And you're like, I don't think it is. They're like, well, I'm the therapist. That's the latent content. You don't get to argue with that. So it's a real kind of power imbalance, and so there are lots of criticisms of psychoanalysis. So while it is good that this has led to this application, actually there are lots of problems with psychoanalysis. Psychoanalysis of dreams can be particularly useful for trauma survivors and PTSD patients. These are people who often have really horrible memories that manifest themselves in nightmares, and it can be really hard to understand what's going on there without some kind of detailed analysis. And there is some evidence that psychoanalysis of dreams has helped these patients with their recovery. It's kind of few and far between. It might just be that talking about stuff is good in general rather than psychoanalysis in particular. But it does seem that it may be able to help people with these particular problems.